The prevalence of myopia in the world right now is 30%.
My God.
That's hell of a lot. If it goes uncorrected, a child will have headaches, pains, because there will be a lot of accommodation.
Right.
And
Especially because they are studying.
Can get squint and amblyopia or lazy eyes. We have to take care of hypermetropia also. ICL is a misnomer. It's not implantable contact lens, but it's implantable collamer lens.
Did you know 85% of the world's population wears glasses? तो millions में नहीं, billions में लोग आज glasses पहन रहे हैं. Welcome back everyone to our podcast with CFES. Today we have a very special guest with us, Dr. Rajan Pradhan. So what's so special about this guest? Dr. Rajan is a very experienced ophthalmologist with 35 years of experience. So आज हम dive करेंगे into his experiences and we learn all about everything that he's learned in this field of ophthalmology. So tune in and follow and subscribe for more medical related podcasts. Dr. Rajan Pradhan. He is a very senior ophthalmologist with more than 35 years of experience. He completed his residency from a well-renowned institute, AIMS. And Dr. Rajan Pradhan has worked with several governments. He has also worked with private institutes and also non-profit organizations. Dr. Rajan Pradhan holds community ophthalmology very close to his heart. And he has accordingly worked in various projects such as project on controlling blindness. He has also set up eye banks and has extensively worked in setting up eye camps in rural areas where healthcare is inaccessible or very difficult to access. So Dr. Rajan Pradhan, it's a great honor to have you here. Welcome to our show.
Thank you very much. Pleasure to be with you.
Sir. Thank you, sir. So, sir, today we want to talk about something as basic. We want to start and talk about something as basic as wearing glasses. So, we see millions of people wearing glasses today. So, what could be the reason for, so many people wearing glasses, be it kids, be it adults?
Yeah, I could correct you on that. It's not only millions, it's become billions, So, it's all because of refractive errors, which means that the image which you're supposed to see is not pinpoint and clear. So because of certain errors in the refracting system of the eye, either it's a cornea or the crystalline lens or even the retina, So I think it is a good platform to talk about myopia now, which is called nearsightedness.
Right.
That means you are able to see near things, but you cannot see distant things. Myopia of late has become an epidemic. Even the WHO has called it an world epidemic. So okay. I myself was quite concerned and quite surprised to see that there are at least several billion people in the whole world, including kids and elder adults, who have myopia. That is nearsightedness. What happens is the rays of light from a object, a source, image does not fall into the retina and get a pinpoint image. It falls in front of the retina, so you get a blurred image. For that reason, you need to have that rays of light diverted, and so you have to wear divergent lenses, that is minus lenses.
Okay.
So let me talk a little bit more on myopia. So like I said, it's become an epidemic, and I believe the prevalence of myopia in the world right now is 30%.
My God.
That's hell of a lot. And by 2050 it's going to become 50%. That means about 5 billion people in the world will be wearing glasses on account of myopia, and 1 billion people will be wearing glasses because of high myopia. So
okay.
Eye care professionals, governments, everyone is quite worried about what could be the cause? So you may ask me, what are the causes why we have this
Yes,
problem?
sir, exactly. That would be my next question.
So, number one, we always used to think it's genetic, like parents wearing glasses, like I wear glass, my wife wears glass, all my children wear glasses. That is genetic. Another is environmental, environmental in the sense that, if you are not exposed to too much of sunlight and you are not going out to play in the fields for 1 or 2 hours, not much exercise, you don't get enough fresh air. That is another thing. I think that is exactly what is happening now.
Right now.
Because
it's lifestyle changes.
Lifestyle changes. Children, rather than going out to play, they play with their iPads or iPhone or whatever. Parents come and complain to us, eye care professionals. My child is looking at the computer or the iPhone all the time. What should I do? It's difficult to answer, Without using a computer or iPhone, you cannot learn anything. And if you use too much of it, that is what is happening, So
I think we'll have to create a balance somewhere,
Exactly.
Move out in the sun as well. And
Exactly.
we cannot, it's inevitable to not use phones and laptops anymore.
Exactly.
But we can put away time to go out in the sun, and play.
Yes, there has to be a balance, some kind of a balance in these
Correct.
several years. Otherwise, it's going to be disastrous. And I believe annually, on account of this problem, the world is losing billions of dollars, for people not being able to work and children not being able to study properly and things like that,
Right.
So it is almost like disaster.
Sir, I've also heard that myopia, like when we speak about myopia in India, it's very high in this region, where we live, like in the east region. Right. What could be the reason
you could be
behind
right.
it?
You could be right. That is a little bit of genetic, So myopia usually affects a lot of people in East Asia, Southeast Asia,
Right.
probably of their racial things.
Built
Like
up, yeah.
Mongolian race have more.
Right, sir.
Like,
so before we get into that, I know we've spoken widely about in detail about myopia, but there are other refractive errors also, right? Far-sightedness.
Yes.
And also astigmatism. So can you
Yes.
show some light on these topics?
Far-sightedness means a person is able to see far objects well and near objects is not able to see. That can happen from childhood onwards as the eye grows. The eye may be smaller when the child is small, and as he reaches adulthood, eye grows to the normal adult size. So that could be corrected just by waiting for the child to grow into an adult. But in the meantime, the child will have to wear full correction, either glasses or contact lens or whatever. So this is not that much of a problem as myopia is, but of course, this is called hypermetropia, hyperopia, or farsightedness. If it goes uncorrected, the child will have headaches, pains, because there will be a lot of accommodation.
Right.
And
especially because they are studying.
Can get squint and amblyopia or lazy eyes.
Okay.
So we have to take care of hypermetropia also. And the third one is astigmatism. That is, he is neither able to see distant well or nor near well, because vertical and horizontal meridians, they are different powers. That has to be corrected with glasses or toric contact lenses, and that is not much of a problem. That can be corrected if it is a regular astigmatism at 90 degrees. If it is irregular astigmatism for various reasons like trauma or birth or something, then that is very difficult to correct.
Right, sir. Okay. So, thank you for telling us what the difference is. Mm-hmm. So, now that we know that refractive errors, it's because of refractive errors that we're wearing these glasses. So, we're basically correcting the refractive error that has happened.
Yes.
So that the rays of light reach the exact point where they're supposed to, so that we can see clearly.
Yes.
Right. So, sir, as you mentioned, refractive error a lot of times is genetic, and sometimes it is because of environmental factors. So, I mean, is there a way, like you already mentioned that you have to change your lifestyle, go out in the sun. Is there any other way that we can prevent refractive errors from happening?
Probably early on, the teaching was that, I mean, it's genetic, and once you have it, you cannot help it. You get it corrected wearing glasses or whatever. Now, so many studies have come that lot of near work, using too much of computers, iPhone, iPads, not going out into the sun more often, or playing in the fields more often, that could lead, let's say a bookworm has more refractive errors than a footballer. Like Ronaldo
Okay.
doesn't wear glasses, and I, a doctor, has to wear glasses. So
Right.
you will see a lot of doctors
So
wearing
it's
glasses.
not very much also, so because a lot of times, parents come and they complain that my child is using a lot of laptop and iPad. So it is not just because of the screens, it can be because of being in the indoors. That's what you're saying.
Yes, one of the reasons, one of
Right.
the many reasons.
Okay, that's interesting. So, like this we were talking about prevention, but now, as you mentioned, we correct refractive errors using glasses. Is there any other way to correct refractive errors? I know we have come a long way, and there have been a lot of innovations in eye care. So, what are some of the different, modalities through which we can correct refractive errors?
Yes. For children, let's say from even small infants of 1 year also may need correction. For him or her, you will have to give him glasses. He or she may not want to wear glasses. You have to give him the sturdy frame, plastic glasses, tied at the back with string or something. You cannot do procedures on a small kid.
Small.
You cannot do procedures even on a bigger kid until the patient is about 18 years and the refractive error has stabilized for at least 1.5 to 2 years.
Okay.
Probably 19, 20 years would be a good time for getting on with some kind of a surgical intervention procedure.
So, what are the surgical interventions that are possible here?
Yeah, I think the most common. Let me tell you, before this LASIK, that is laser assisted in situ keratomelusis, that is the full form of LASIK. And before LASIK came in around 30 years ago, I still know that they used to do a procedure called radial keratotomy.
Okay.
Or RK for short, And there's an American way of doing it and Russian way of doing it when the Cold War was going on.
Okay.
So what the main funda is to make the cornea flatter.
Okay.
According to how much of refractive error, myopia you have, So radial cuts are made with diamond knives, almost 90%. The American way was to cut from the middle, just leaving the optic axis towards the outer parts. The Russian way was to do it from the outer part towards the center. So it worked. It was the in thing to do or get done, for several years. And finally, researchers found out it's not a good thing. It causes a lot of problems, and they've found that you cannot play contact sports with it. Okay. If someone boxes you in the eye, everything, it falls open, and you lose your eyesight. Okay. There have been instances when horse riding, you fall off the horse and everything breaks open and you lose your eyesight. Now RK is, I think, illegal. It's not a legal thing to do. Okay. But we do come across older patients who have had that done,
Yeah.
So that is just the historical part. Now I think the in thing is like LASIK. So in LASIK, you use excimer laser. What is done is cornea has 5 layers. The outer layer is called epithelium. It's a very, very thin layer. You make a flap either with a femtosecond laser or with a microkeratome. And again, it's all about making the center part of the cornea flatter.
Flat.
So you bombard it with excimer laser. Everything has been calculated. It's not that difficult because there are normograms, there are logarithms, everything is there, and a lot of AI is used in the procedure. Then it just takes a couple of minutes or even less. After that, you close the flap, and from tomorrow onwards, patient is able to see clearly and is very happy. That is LASIK.
That's interesting, sir. So what I understand, sir, is refractive error is happening because there is irregularities in the cornea. It's not smooth, it's not flat.
Irregularities in the cornea.
Yeah, like it's not smooth. As you mentioned that these process, they smoothen out, they flatten the cornea.
No. What happens, cornea is not a bowl kind of thing. It's an aspheric tissue. Aspheric means it's steeper on the center and it's flatter on the periphery.
Right.
So the more myopia you have, the steeper the center is.
All right.
So what it needs to be done is that center has to be flattened,
Okay.
removing the epithelium.
Got it.
Yeah, not irregularity, it's steeper.
Steeper.
So it has to be flattened by calculating with computers and AI and all that.
Right. So,
how
sir,
much
LASIK corrects nearsightedness or does it also correct
it
farsightedness?
can be used for both. I think even astigmatism can be corrected,
All
but
right.
mainly it's used for correcting nearsightedness,
Which is myopia.
myopia.
Got it. So, sir, other than LASIK and as you mentioned the RK method, we've been hearing a lot about ICL these days.
Yeah, before I see, let me talk about a procedure called SMILE. That is,
Yes, that's another procedure.
a small incision, small incision lenticle removal.
Okay.
So again, the funda is to flatten the cornea. Here, you don't make a epithelial flap. You just cut a part of the cornea with a femtosecond laser, and again measuring with a computer or all these
AI.
high-tech machines, you'll have to know how much of that is to be removed. Not you, the machine will know how much of the lenticule has to be removed. You just remove, then again the cornea is flattened, and again the patient can see well. That is called SMILE. Then there's another new method called silk also. I don't want to go into that. And another is orthokeratology, I think. Orthokeratology. What is done is, suppose a child has myopia of -5 or something. So nothing is done. Even for a child, this orthokeratology works because it's not an invasive procedure.
Okay.
A rigid contact lens is put over the eye overnight. That flattens the cornea. That tricks the eye into believing that the eye is okay. The whole of next day, that child or adult will be able to see clearly. But again, at night, cornea comes back to the same steep configuration, and again that has to be put. That is orthokeratology. That is practiced by some people. Then another procedure.
Sir, sorry to interrupt you. Is this not uncomfortable to put the rigid contact lenses on top?
I don't think so. Before the soft contact lens came into the picture, everyone was using rigid contact lenses.
Okay.
That was about 30, 40 years ago.
Okay. And this is not something that they need to wear the entire day. They can just wear it at night and...
Yeah, this is a very temporary thing, just so that whole day you don't need to wear contact lens or glasses. You can see again, it falls back to its original thing, and whole night that is put, and next day is... This is one of the ways of doing it, a temporary mechanism.
Right, sir.
This is all book reading. I've never seen it done, but this is one of the ways of doing it.
Okay, sir. So moving on, you were talking about, I think, ICL.
Implanted contact lens.
Yes, sir.
It's called phakic IOLs. Phakic means the crystalline lens has been removed.
Okay.
Phakic IOLs means you have a crystalline lens over that another contact lens is placed. So it's basically ICL is a misnomer. It's not implantable contact lens, but it's implantable Collamer lens. Collamer is a
Bond.
material made from plastic and some monomer, so that it becomes hydrophilic. That is, it takes in a lot of water, very thin, very pliable, and biocompatible.
Okay.
So early on, these phakic IOLs used to be placed in the anterior chamber over the iris, iris clip, claw lenses and things like that. They had a lot of complications like disinsertion and touching the endothelium and causing a lot of glaucoma and things like that. Now this ICL is put in front of the crystalline lens and behind the iris.
Okay.
Very, very, very minimal invasion, just about 2.5 to 3 millimeter of incision, and the ICL is folded and pushed into that is called the posterior chamber. That is a potential space where you place it there. And early on, you had to make holes in the iris so that the aqueous made in the ciliary bodies would flow out and not cause glaucoma. But now they make hole in the center of the ICL, so that you need not do anything with the iris, nothing. So,
right.
Yeah, it's almost miraculous that just put a few drops of proparacaine and maybe a little bit of intracameral into 0.5% of lignocaine without preservative, and that is about all. The patient will not feel pain or nothing, and like a miracle, he or she will be able to see immediately or after one day. But most doctors do it on both eyes. What they say is the complication rate is very less. But I do ICL, but I do it one eye at a time because complications may be less, but complications are not nil. If you do have complication and lose both eyes, what happens? So that's about ICL. I think it's less invasive and it's reversible. Unlike LASIK, where you make a signature kind of thing which you cannot undo ever. In ICL, you can remove it anytime you want. If there's a complication, you can remove it. And the patient, when he turns 60 or 70, develops cataract, you can remove it and do a normal phacosurgery or whatever surgery, put in another intraocular lens, and everything will be perfect. I wish you all the best.
So, finally, as we wrap up, what is one advice you would like to give to our listeners to, so that they can take care of their eyes and, make sure their eyesight is good for the longest time possible?
Do not buy any medicines over the counter. People buying all kinds of medicines over the counter or using WhatsApp or Google to
self-treat.
For self-treatment. I think I would request my fellow listeners, my potential patients, please do not do that. Go to a doctor, go to a compassionate, empathetic doctor who would give you a discount also or probably see you free also.
Yes, sir. So we know we do a lot of, eye camps, as well as there are a lot of campaigns that go on donating a cataract surgery that is becoming prevalent in India, and we would like everyone to get involved in such practices so that more and more people are able to see clearly, because cataract is something that is preventable blindness.
Yes.
And all of us as a community can contribute to that. So thank you so much, sir.
It's called needless blindness.
Yes.
It cannot be prevented, but it's needless.
Yeah.
You could do avoidable blindness.
Avoidable blindness. Correct.
Just let's say 1,000 rupees surgery could take care of it.
True. Yes, sir. Thank you so much, sir. It was wonderful having you.
Thank you very much, Simran. Great talking to you.
Thank you, sir.
I wish you all the best in your career.
Thank you, sir.
And you're learning a lot, I can see.
Thank you so much, sir.
Thank you.